We are professional nurses and midwives working all around the world. We share our vision of health for all. We have the potential to help, support, and inspire each other. Just talking with others with similar experiences really helps to find solutions to challenges we face. To be connected with colleagues in other countries allows us to discuss policy issues, share innovations, and grow partnerships that strengthen our profession. We have so many ideas. Sharing these with others gives us a way to work on future plans and grow our skills as leaders. When we come together, we become better able to serve our communities, improving health for all. Join the Nursing and Midwifery Global Community of Practice and be part of our worldwide family.
Good afternoon, ladies and gentlemen, and a very, very warm welcome on this really special day when we've come together across the world to celebrate and say thank you to the work of midwives. You are very, very special people, and we are delighted to be able to celebrate in this day with you. We have a fantastic lineup for you today. I think there's some fantastic speakers I'm going to introduce you to shortly. But from our side and from the WHO, I just want to reiterate, this is your day. Thank you so much for the work that you do. Sometimes we feel that people are unvalued, and today we want to make sure that that is not the case. Every day you are making a difference to the lives of the women, the children, the babies in your communities, and bringing new life into the world and supporting life to thrive and prosper. It's a really, really important, special role. I'm a midwife. I'm proud to be a midwife. I've been a midwife since 1993, and every day I'm thankful for the work and the opportunities we get to make our mark on this world. So today is your day. We celebrate with you together, again, from evidence to reality. So just before we really get going on the nitty-gritty of this fantastic lineup, I'm just going to give you some housekeeping slides. Echo, if you'd like to just fall onto the slides. So in case you're not sure you are in the right place, this is all about midwifery, 100% all about midwifery today. We are really happy to say that we are bringing this to you in the 6 United Nations languages. So if you'd like to listen to the live interpretation in Arabic, Chinese, French, or Russian and Spanish, just please do click on the interpretation button at the bottom of your screens. If you choose the language that you would like to hear, then you will be able to mute the original audio and you will just hear the webinar in your selected language. We do really try and bring these webinars to you through the community of practice in as many languages as we can. And we do realize it's really difficult to listen and to engage with them if it's not your primary language. So we are hoping that we can help you to work with us and to learn with us together today. The next slide we're going to show is live transcription. So if you would like to see the webinar with subtitles, just please click on the show captions button at the bottom. The captions will appear on your screen. If you prefer not to have that, you just need to click on the button that says hide captions, and you can see just there how to do it. Then you'll see at the bottom of your screen, and as per usual with these sessions, we want to have a really wonderful interactive session. So we have questions and chat. So please do use the question and answer feature for questions regarding the topics, the presentations, and our wonderful panel will try and answer them as we move forward with the sessions. We do have some time allowed towards the end of the session for a live Q&A, when we will have some moderators who will pick out some of the really great questions and put them to our panel. So don't be shy about asking your questions, just put them into the Q&A. The other feature that we have is the chat box. So please use that. I see some of you are already happy to use that. Introduce yourself. Do tell us where you're coming from. It's lovely to know how global our audience is. We normally reflect many, many countries, over 100 countries represented at our last webinar. So please do tell us where you're coming from today. and your role, and any messages you have to your wonderful global midwifery colleagues. The recordings, we will record this webinar, and recordings will be available for you to listen to on our community of practice in a day or so after today. And it will be available in all the languages that it's being interpreted in as well. So if you don't get to listen to the full session, or you'd like to share the sessions or encourage your colleagues to listen at another time, you'll be able to listen again on our community. After the session is complete, we will be asked to complete a really short survey, just a feedback survey, to give your views of the session. And once you've done that, you'll be able to download your certificate of attendance. So feel free to do that if that's useful to you, and then you have it straight into your inbox. And then the next one we have, we do use your data. Thank you for sharing your data with us in your registration forms. We are very careful and responsible with your data, and we use it to develop programs moving forward on subjects that matter to you. So we look to see where you're coming from, the languages that you like to listen in, the subjects that you raise, the things that are interesting to you. But we just want to say that we take your data and protect it very carefully. And I think we've probably come to the end of that. So without further ado, I'm going to introduce you to our three initial speakers. So these three people are really important to us all. They really are thankful to the work that you do, and each one of them in turn wants to give you their own special message. We're going to start off with our wonderful and new Chief Nursing Officer, Dr. Amelia Latu Afuamango Tuipulotu, come from the Kingdom of Tonga back at the end of January, and really supporting midwives around the world. She has some messages for you that she's going to share in a minute. We're going to follow on from that video with a message from Dr. Anshu Banerjee. For those of you that don't know Dr. Anshu, he's the director for the Department of Maternal, Newborn, Child and Adolescent Health and Aging at the WHO, possibly the longest job title of any of us, really wanting to thank everybody around the world. He understands midwives and midwifery, working with them every day, and wants his messages to you to be heard. So we'll hear from Dr. Anshu. And then finally, the third video that you'll see will be from our dear Dr. Tedros Adhanom Ghebreyesus, our WHO Director General, and I'm sure he'll need no introduction to all of you, but is really wanting to say his thoughts, his words to you today, particularly on International Nurses Day. But I know every day he's supporting the work that you do, and working towards strengthening midwifery everywhere. So we'll hear from all three, and then I'll be back on to introduce the second part of our session. So we'll hear those now. Thank you.
I am delighted to be together with you again, celebrating the International Day of the Midwife. You accompany us across our life cycle and our choices, through which we are brought into humanity. I applaud the extraordinary work you are doing, providing compassionate, safe, and quality care. And you are referred to, with our nurses, the heroes of our time. Evidence suggests that investment in midwifery care would yield important returns, including, first, more positive birth experiences. This is already impacting realities for women and newborn around the world. Second, improve health outcomes. And third, inclusive and equitable economic growth. We therefore all have a duty, as we celebrate today, to continue to raise the profile and translate this grand evidence to solutions. It is time to act now to promote, support, respect, and value midwifery in order to attract and retain midwives for the long term. To ensure continuous professional development is a reality. To transform midwifery education to international standards. to support equitable distribution of midwives in cities, in rural areas, and outer islands. I conclude, together, let's celebrate on all grounds and at all levels to ensure that sound evidence transform midwifery care, health systems, supporting universal health coverage, sustainable development goals, ensuring inclusive and equitable development, and improved health outcomes for women, newborn, and for all.
Good morning, good afternoon, and good evening. I, from my side, would also like to welcome all participants to this celebration, but of course, particularly all midwives. Today, the world's SRMN-AH workforce, or sexual, reproductive, maternal, newborn, adolescent health workforce, can only meet 75% of the world's SRMN-AH needs. However, the gap is wide between low, middle, and high-income countries, with at the lowest end, for example, one low-income country meeting only 41% of demand. In 2021, we estimated that we had a global shortage of 1.1 million dedicated SRMN-AH equivalent healthcare workers to cover the need for SRMN-AH services. Of the 1.1 million healthcare worker shortage, an estimated 900,000 were midwives. Unfortunately, this gap is expected
Shall we move on to the Director General's video if we're struggling with that one? Sorry about that, everybody. We may be able to get back to Dr. Banerjee later on.
Dear colleagues and friends, my greetings to everyone joining today, and especially to all midwives. We have come together to recognize the extraordinary work you do all over the world. Research shows the vital role midwives play in providing reproductive health and family planning services, and in protecting and promoting maternal and newborn health. Yet, we still need hundreds of thousands more midwives to meet the health needs of our communities. We must improve the quality of education for midwives, increase the number of midwives in senior leadership positions, and make sure they are supported and protected in their workplaces. WHO collaborates with our sister agencies, UNFPA and UNICEF, and the International Confederation of Midwives to advance these policy areas in the WHO Global Strategic Directions for Nursing and Midwifery. I would also like to encourage you all to engage with the nursing and midwifery global community of practice, which forges connections, builds the skills of nurses and midwives, and amplifies their voices in global dialogue. Thank you to each and every midwife for all your efforts to safely bring new life into this world. I wish you a very happy International Day of the Midwife.
Oh, thank you very much, Dr. Tedros. We always know that you support us, and it's lovely to hear you today. I'm now going to hand over the moderation of this session to my wonderful colleague and midwife, Frida Berg. Frida and I have been working together for the last few months. It's been an absolute joy. Frida is a technical officer in nursing and midwifery in the Department of Maternal, Newborn, Child and Adolescent Health and Aging at the WHO. I've only ever met Frida once, but we speak together probably 3 or 4 times a day. So I'm just going to hand over to you, Frida. We've got a wonderful team coming to present to you today. So over to you. Thank you.
Thank you so much, Emily. And yes, I have wonderful presentations to introduce for you, and also a fantastic gang of midwives who are so passionate about the work and to do so many things for the midwifery in this global world. So the first presentation we will introduce for you is Evidence to Reality in the 6 countries strategy findings. And the presenter for this presentation is Clara Fischer and Professor Lorena Benfa. Over to you.
Thank you, Clara. First of all, happy International Midwives Day. Including both public and private sectors. The countries include Sierra Leone, Malawi, Liberia, Bolivia, Pakistan, and India. WHO is being supported by the Merck for Mothers Foundation to implement this project, which is part of a wider program strengthening quality care for mothers and newborns to achieve universal health coverage. The framework is based on a 7-step action plan, which will be fully described later. The next, please. And this project is also focused on the WHO Global Strategic Directions for Nursing and Midwifery 2021-2025, which presents evidence-based practices and an interrelated set of policy priorities that, if adopted, can help countries ensure that midwives and nurses optimally contribute to achieving universal health coverage, another population health goal. The strategic direction for nursing and midwifery comprises 4 policy focus areas: education, jobs, leadership, and service delivery. Each focus area has a strategic direction, articulating a goal for the 5-year period. Enactment of the policy priorities can support advancement along the 4 strategic directions. This project, which we work on, is focused in 2 areas: education, through educating enough midwives and nurses with competencies to meet population health needs, and leadership, through strengthening nursing and midwifery leadership throughout health and academic system. The next, please. Some emerging issues that appeared during the project, and I have to say that most of our work consisted in gathered data, and this was done through surveys, meetings, interviews, and desk review. And we found that an important point was coordination and alignment. There was a clear and urgent need for coordination and alignment of implementing partners and donors behind one government plan for midwifery to maximize investment. This led us to promote midwifery leadership through establishing a national midwifery task force And this is possible and empowering to assess national midwifery leadership capacity and identify action needed. Well, I mentioned that data was collected because government requests for a mechanism to collect, analyze, and manage and have ownership of midwifery data, a country-level dashboard. Working in collaboration with the private sector, which is complex and highly politically sensitive, need to know more for better integration of public and private sector as we're promoting this collaboration. And the last theme that emerged was about climate change, because droughts, rising temperatures, and natural disasters are a threat to maternal and newborn health and will therefore impact work of midwives. So this was another emerging issue in terms of access to information by midwives, and that is missing, needed, and it's a strong demand. The next, please. And finally, the 6 countries that were participating in this project were first starting in India, Pakistan, Malawi, later Sierra Leone and Bolivia, and the last country that was incorporated was Liberia. Over to you, Clara. Thank you very much.
Thank you so much, Lorena. Thank you. Hello, my name is Clara. I'm joining you today from the Family and Reproductive Health Division at the WHO Country Office in Liberia. And I just returned from the national celebration of midwives here in Liberia, organized by the Liberian Board of Nursing and Midwifery. And I would like to also take the chance to congratulate all midwives joining us today on this celebratory day. Your dedication and your resilience is inspiring me every day. So thank you for joining. As Lorena has introduced you now to the framework for action on strengthening midwifery education and leadership, let me dive into our methodology, the 7-step action plan. Rather than focusing primarily on national midwifery curricula when improving midwifery education, the 7-step action plan acts as a guide to help build sustainable midwifery education and training, and doing so by systematically building partnerships around midwifery leadership and adding public engagement and advocacy. The 6 countries in the framework for a global community are all in different stages of this circle, but after reviewing outcomes, there will always be a reason to act on new challenges. It is supposed to be a never-ending circle. Next slide, please. One of the first tasks for all countries when launching the framework for action was to create a country midwifery leadership profile. I will not have the time to walk you through our methodology in detail, but the aim of the leadership profiles was to map midwifery education and leadership in each country by interviewing stakeholders and partners and midwifery practitioners. The outcomes you see here summarize the findings that were similar in all countries. A successful transition to midwifery-led care can only be achieved by individuals who are willing to become leaders and visionaries in their discipline. The leadership dilemma we found on different levels in all countries was that there seems to be a missing collective midwifery identity and a low status of women in society, holding back individuals to serve as leaders. Although I would like to add that these results cannot stand alone, one needs to have an in-depth understanding of midwifery practice in each country, and that is reflected in our leadership profiles. Next slide, please. Let me briefly present the framework collective achievements. Although each country would probably have many national achievements to add at this point, the list of achievements would be very long. We established national midwifery leadership task forces in all 6 countries in order to create a forum for midwifery stakeholders and individuals to exchange knowledge and overcome challenges in leadership. We developed tools and methodologies, such as the first global midwifery leadership profile tool. Our country midwifery leadership profiles identified the levels of involvement of midwives in policy development in each country, as well as helping and hindering forces in the participation of midwives. And here on the slide, you see pictures of our global midwifery conference in Sierra Leone last year. Next slide, please. One of the framework for action's strength is the global impact it has by collecting knowledge and connecting midwives on an international level. We are able to improve the alignment of international midwifery stakeholders and the coordination of midwifery globally. We support the Alliance for Improving Midwifery Education with the purpose to jointly implement the framework for action, and we see the implementation of the framework for action as a milestone in strengthening the health workforce of midwives globally and in ending preventable maternal mortality. Thank you so much for your attention, and I will give over to you. Thank you so much.
Thank you so much, Clara and Lorena. That was beautiful. And I assume a lot of people have a lot of questions, and so don't hesitate to ask them if you want to. So let us introduce the next presentation. Yes. So this presentation is about the stage, and those who will give this presentation is Jane Sandall, Professor Jane Sandall, and Justine Leles. Over to you.
Hello, everyone. My name is Jane Sandall. I am a stage member, and I'm going to talk about the background to this exciting new work. Next slide, please. So we've already discussed the problem that we have. We have 800 maternal deaths, 5,400 stillbirths, and 6,500 neonatal deaths every day. We know there is poor quality of care, and we know there's a global shortage of at least 900,000 midwives, and that women are asking for better support from their health workers, including midwives and nurses, to provide high quality, respectful care. Next, please. So one of the solutions is to transition to midwifery models of care, which means the process through which countries move over time from having no midwives to well-functioning health systems with midwives who are supported in the health system, educated and regulated to provide high quality care to women. Next, please. So this is evidence-based. It's based on research on the impact of scaling up midwifery. This work was produced for the last set of series and then updated for the State of the World Midwifery. If we had 80% of women providing skilled care by midwives, we could save 4.3 million lives a year. We've also covered if we had at least 25% increase in coverage, we could save 2.2 million lives a year, and even a modest increase, we could save 1.3 million lives a year by 2035. Next. Other evidence that we're drawing upon is Cochrane review on the impact of continuity models of care. This is where midwives, a small team, provide care to women right across the care pathway and follow the women into whatever care settings they're having their baby. Importantly, there's an improvement in outcomes and babies and women's experiences. Next slide. There's some work that was done this year looking at continuity of care, which was a review of where it was done, how much and who by you'll see from this map that the majority of low and middle income countries do not have high coverage or even any coverage at all of continuity of care models. Next slide, please. I'm going to hand over to Justine Lelay at this point.
Thank you very much, Jane. Yeah, so this is about a work conducted by the Strategic and Technical Advisory Group of Experts that we call STAGE for maternal, newborn, child and adolescent health and nutrition. So what is STAGE? It's an independent advisory group established during the pandemic in 2020, which advises directly the Director General of the World Health Organization. It has 31 members from all WHO regions, and Professor Jen Sandel, who is co-presenting with me, is one of the members. And this STAGE group is chaired by a midwife, Caroline Homer. And the main objective is to provide strategic and technical advice to the World Health Organization on maternal, newborn, child, adolescent health and nutrition, and to inform the WHO agendas for primary health care and universal health coverage, with a focus on maximizing country impact and coordinating global leadership in the field. Next, please. In May last year was presented to STAGE the context about midwifery and midwifery models of care, and STAGE made 3 main recommendations about it for countries that wish to transition to midwifery models of care. The first recommendation is that the World Health Organization to support countries that are transitioning to a collaborative midwifery model of care, requiring professional midwives with policy advice and implementation guidance. This transition and the model of care will depend on the context of the country, health system, and should be aligned with integrated health workforce solutions. Next, please. The second recommendation is for WHO to convene a STAGE working group to develop implementation guidance to support countries transition to a midwifery model of care. This should be aligned with the member state endorsement of what our colleagues presented in the first presentation, the strategic direction for nursing and midwifery, endorsed at the World Health Assembly of 2021. And this implementation guidance should be developed within a 12-month time frame, as well as an agenda for evaluation of implementation of midwifery models of care in different country health systems. Next, please. The third recommendation endorses the WHO Global Nursing and Midwifery Community of Practice platform to establish a continued learning agenda on transitioning to midwifery models of care, linking with several global strategies such as the Ending Preventable Maternal Mortality, EPMM, Every Newborn Action Plan, ENAP, and other global programs for improving continuity of maternal and newborn care and improving outcomes and prevention of stillbirths. So before explaining to you how was built this working group to answer to those STAGE recommendations, let me come back to a work that WHO has been doing about midwifery models of care theory of change. Next slide, please. So from a rapid literature review, I'm not going to go too much into detail. This slide is to inform you on how the structure of the working group was established. It's from this theory of change that identified 5 domains that are necessary for countries to transition to midwifery models of care. 2 large virtual meetings were organized, and 90% agreement was made with this domain. So then the parts that were not in agreement were changed. An online survey was conducted last summer, and the WHO is now soon to be ready to publish an article about this theory of change. Next, please. So this is the full theory of change that will be soon published. Next, please. From those domains of change, next slide, please. Thank you. Was organized the working group. So you have the main working group of 20 members, which we will see just after, and 3 subgroups. The first one is called the midwife, the second health systems, the third one enabling policy, regulation and environment. It comprises 2 of the domains of change, And the domain of change of women, newborn families, and communities was identified as crucial, and therefore should be a cross-cutting issue across those subgroups, as well as the monitoring and evaluation plan or framework. All of the work is supported by WHO with WHO Secretariat. Next, please. Each subgroup has 2 co-leads, where you can see on the left side of this diagram, and the co-leads are members of this working group. So the Staged Midwifery Working Group is chaired with 2 co-chairs, Jane Sandel, Professor Jane Sandel here today with me, and Sally Pierman, the Chief Executive of the International Confederation of Midwives. So as I was saying, we also have the co-leads of the subgroups, stage members, including the stage chair, Caroline Homer, professional organization, because this work is about collaborative teamwork. So the organization of gynecologists, pediatricians, but also nurses and neonatal nurses. UN partners like the United Nations Population Fund and UNICEF. And also crucial to this, women's voices with women's group. Next, please. In the structure of the subgroups, we can't for the moment tell you about the membership, but what we can tell you is that there was a very important focus on making the geographical distribution equitable among the regions of the world and also sub-regions, as you can see in this graph. We have people from the academia and research, midwifery teachers, midwives, professional association, regulatory bodies, government representative, health system specialists, program managers, but also representative from women, newborns, families, and communities groups. And more than 60% of those subgroups members are midwives. Next, please. So what are going to be the next steps? We will be presenting the work to stage on the 16th of May 2023 to provide updates, and then final standardized framework for developing guidance, start the subgroup discussions, and draft the implementation guidance to present it to stage before the end of this year. Thank you so much for your attention.
Thank you so much, Justine and Jane, for this brilliant presentation. So now we need to go quickly to the next one. So the next one presentations will be coming from Dr. Florence West and Inderjeet Kaur. So over to you.
Thank you, Frida. Just checking that you can hear me.
We hear you fine.
Thank you so much. I'm Florence West. I'm based in The Hague in the Netherlands, currently in Australia, in Brisbane, joining you. I want to thank the organisers of today for bringing us all together on the International Day of the Midwives 2023. The WHO Interprofessional Midwifery Education Toolkit recognises that not only midwives look after women and their newborns during the childbirth continuum, but we need to draw on all levels of expertise. And so an education package focusing on normal birth was developed by WHO with the support of funding partners based on the WHO evidence. So we're looking now at a slide that describes the toolkit comprising of facilitator and learner guides, has a blended learning approach focusing on the midwifery model of care throughout the continuum with the cross-cutting issues of respectful care and mental health and leadership included, and really clear links to other WHO courses. Thank you. Next slide. As you can see here, it's grounded in the Quality Maternal Newborn Care Framework, practice categories for all childbearing women and infants, and for those childbearing women and infants with complications, covering the organisation of care, values, philosophy, and the various care providers. Next slide. So just to give you a brief snapshot of the Essential Childbirth Care course, which is one course in the Interprofessional Toolkit, which is derived from the WHO evidence, the various documents you can see on the slide. Next slide, please. The first module in the Essential Childbirth Care course is the introduction module, which is published on the WHO website. And you can also see that there's 4 other modules from 2 to 5 covering the first stage, second stage, third stage of labour and respectful referral, with the goal to improve the quality, provision and experience of care for women. Next slide. So there was it was acknowledged that in many countries, India being one of the pilot countries for the toolkit, that a new cadre of midwives and midwifery educators needed to be supported. And Fernandez Foundation helped with that in India at Fernandez Hospital. And this was supported by Indi Kaur, who will speak now about her experience translating the evidence into practice using this innovative new training technology. Thank you, Indi. And we'll just stay on this slide, I think.
Thank you.
Oh, yeah, Indi, you could direct this the slides with
I
us.
will.
Thank you.
Thank you very much. Good evening, everybody. My name is Indi. I'm a professional midwife from the UK, but I'm now in India, and I've been in India for the past 5 years, working on professional midwifery and embedding it in the country, working closely with WHO and Fernandez. Now, India has made enormous strides to midwifery-led care in the country, and we had the privilege to pilot the ECBC care guide, and our National Midwifery Training Center in Fernandez has impacted over 10 states across India, and we know that in order to be a midwifery educator, you need to know the midwifery philosophy, and most of our educators came from a background that they had to learn from the beginning. So this ECBC course was really beneficial, because what it did was to introduce the educators, the different methodologies, and we felt that it was important to include this and integrate this ECBC into continuous professional development. It was helpful because most of our educators were taught very much in a didactic manner, and the toolkit helped them to use several methods that was in the ECBC with regards to for example, the treasure hunts. In India, we not all places have companions, so the treasure hunt that we used was birth companions in labor. So it was very helpful because the learners went to look for the evidence from WHO to see how important birth companions were in a woman's journey. It was also important that because we don't have midwifery educators at the level, and we have international midwifery educators helping to support the midwifery training in India, it was important to use a toolkit so the training and the methodologies could be standardized and translated. We also felt that it was really important because whilst we are training and bringing the midwifery philosophy, healthcare professionals that also deal with childbirth, like our obstetricians and PG students, could also benefit from this. Next slide, please. From the co-design, we had facilitators and learners both in Gujarat and in Telangana, and the educators becoming ECBC facilitators. So we had from the government of Telangana feedback as well from educator in Fernandes. The facilitators from the co-design also was from Gujarat and Ladell. Next slide, please. So if you, next slide, please. The program that we piloted was over 3 days. It was during the heart of COVID, and it's so important to use teamwork. And we actually had healthcare professionals, playing role models, and how important it is of each healthcare professionals playing an important part when a woman comes into labor. And in this instance, in India, of course, we chose the name of Meena, but you can also translate and use names that are relevant in your own country. So the learners apply and understand how teamwork, how important it is to use teamwork to achieve quality midwifery and newborn care. So that was really important. And we had a lot of fun in doing this exercise where each one of them came forward to say how important they were. And it actually enabled a lot of critical thinking, placing the woman and the newborn in the topmost importance. Next slide, please. And also, a lot of times it's women and newborn. So role plays of a healthy newborn and how keeping newborn with mother together and simulation, mentored clinical practice. It was all a new methodologies for our learners, and we also used it before our learners went back into their own states, because as in the National Midwifery Training Institute in Fernandes, we've now completed 42 learners in the first batch and 30 in the second batch. So they've gone back into their states and are facilitating their own learning and also training. So it's really important. They loved the videos, and we couldn't stop them from the role plays because that was so exciting for them. And they were really innovative because they managed to do that in the online practice as well. Next slide, please. So moving forward, what's next? So we are working with partners that what we've done in India, in other countries like Pakistan, Malawi, Sierra Leone, Bolivia, and the resources now are available in the WHO website. And if you need any other information, please contact Frida Berg, who is Technical Midwifery Officer. And the feedback from 2 of our learners from the team was they found the methodologies very useful, and they were able to use this in their practice. And they also gave feedback on where and how the toolkit could be strengthened, and we've adapted it to their responses, and now it's out there in the website for all of us. Thank you very much. Thank you.
Thank you so much, Indy, and thank you so much for this brilliant presentation. So let us jump over very quickly to the next presenter. So I think we have to introduce, so I want you to put on the camera, Mahfoud Jumu. So I want to introduce you a midwife from Bangladesh that will describe a little bit about her situation. Over to you.
Thank you very much, and happy International Midwife Day. I think I am audible. And thank you very, very much. I am feeling very, very much privileged for being here, and I can explain about my own experience as a midwife in Bangladesh. So I would love to explain a little bit about the context of midwifery in Bangladesh. In Bangladesh, the midwifery profession has been distinguished from nursing in 2013. And initially, midwifery was started in 20 government colleges and 7 private colleges. And later on, the number is increased into 62 government institute and 108 private institute. So at present, there is 8,000 registered midwives, and 2,557 midwives are deployed by the Bangladesh government. And some are working in the different humanitarian crisis sector and clinics. And also for the first time, the higher education on midwifery, BSc in midwifery has been started in Bangladesh. And I am also happy for being the first session of BSc in midwifery students. And if I talk about the environment, so midwives are posted, deployed in sub-district level hospital. In around 407 hospitals, there are midwives. In every hospitals, there are 4 midwives working in. And also below sub-district level hospital, there is 820. So we can like imagine where the midwives are working. That is absolutely rural level hospital. And since the beginning, the midwives are facing many kinds of difficulties. And before going into my own experience, I would say that earlier the midwives were not able to work in the private clinics and the hospitals because they were not known to midwifery profession in Bangladesh. And also when we were deployed by the Bangladesh government, the acceptance was not so, we were not accepted warmly actually. So there were a lot of challenges. So when, if I would love to share my own experience, I joined for the first time as a nurse because they did not know the midwife post. And I joined as a nurse in a factory to take care of the worker in the factory. And then in 2017, a cyclone affected area, that is Mora, affected in a certain coastal area of Bangladesh, and I got chance to work for the Mora affected area. And after that, in October, when the refugees were coming into Bangladesh from Myanmar, I got chance to work in with MSF International, the Medicine Sans Frontiers. And later on in 2018, I was deployed by the Bangladesh government and posted in a sub-district level hospital. And in the meantime, I thought to develop my own leadership capacity too. And I became the vice president of Bangladesh Midwifery Society through an online voting system from 2018 to 2021. And I have done a fellowship program that was formal from funded by TED project through by the support of Royal College of Midwives. And currently I have been working as the young midwife leader in ICM. Also, I had opportunities to work in several steering committee and terms of reference committee. And currently I'm studying BSc in midwifery. So this is the higher education. I would say there were so many challenges we were getting, we were going through, but we had many opportunities too. I would say there is highest level government support we are getting, and also we are getting donor support, and we could develop faculty policy and guideline. And also that there is higher education, also master degree is ongoing. And also we are getting in-service evidence-based midwifery training. And one of the most important thing, we are known to the mass people for our pink uniform, and I would love to wear my uniform, as people call us in Bangladesh as Golapi Apa. Yeah, and I would say if we are able to put more investment in midwifery in Bangladesh, and we will be able to like improve our status in Bangladesh. Yeah, I'm a proud midwife, and I'm celebrating here today in Bangladesh Midwifery International Midwife Day. I'm so happy for being here. Thank you very much. I would not talk much because I'm having a little bit problem. Sorry, I'm saying sorry for that. Thank you very much.
Thank you so much for sharing your story. That was really good of you. Thank you so much. So let us now go to the next session. So I will actually jump over and give the word again to Emily, who actually started these sessions. Over to you, Emily.
Thank you very much, Frida. Sorry if you thought you'd heard enough of me today, but I'm back for a little bit more. And I'm really delighted. The presentations have been extraordinarily interesting and really grateful to everybody that's talked today. Keep your questions coming. I know we hopefully will have a short time for Q&A in a little bit. But just before we get there, I wanted to just highlight two things through our nursing and midwifery global community of practice that are being developed through our Chief Nursing Office at HQ in WHO. They're really important initiatives that we really hope will support the work that you're doing, the work that you've heard about today, and obviously the more work that is to come. So the first thing, and I'm sure you're already aware of this, is our global community. It's a community where we encourage nurses and midwives all over the world to join up and to talk and engage and network with each other. There's a QR code on your screen now. So if you have a phone, a smartphone, and you're able to take a picture of that, it will take you directly to the login page for you to join it if you wish to. The website to join is just underneath there. But once you find yourself on that community, there's all sorts of resources that you can tap into. There's an awful lot of information about midwifery and the events and opportunities that are around the world for you to see and to think about. So do join that. And within that community, we listen a lot to the conversations that are going on. There's a forum for discussion, and we host many webinars as similar to the one that you're listening today. And over the course of the last year, we've listened to the questions that you've raised. We've heard the things that you talk about. And one of the things that came out overwhelmingly last year when we spoke about midwifery and nursing in climate change and in conflict and post the COVID-19 pandemic was that midwives and nurses felt that they hadn't experienced enough education or training in emergency care. And when a crisis happened, or when the pandemic came and people had to redeploy and use their skills in different ways, you told us that you felt you were in need of training and education. So I'm delighted to say that on the 7th of April this year, World Health Day, Dr. Tedros, the Director General, launched a new campaign. It's called the 25 by 25 by 25, and it aims to provide training for 25% of nurses and midwives in 25 countries by the end of 2025. So think of your own country where you live, 25% of the midwifery and nursing population of your country, and we commit to training all of them in that. So why do we do that? Because we know that in low and middle income countries, a half of annual deaths and a third of long-term disability result from conditions that we could treat with better emergency care. But we know that care is often compromised in these countries because emergencies may not always be recognized. The initial management is not always provided, and sometimes onward referrals can be delayed. And we know for sure that it is midwives and nurses that are quite often the first person in contact with somebody who's had an emergency. We know that in many countries, you may be the only person. If you're a midwife working in a rural environment or a remote environment, you may be the only healthcare worker. So your emergency skills are really important. And I have the next slide, please. So we want to be able to provide training for you where it doesn't exist already. And we know why our training is often limited. It's limited in what it can provide. Courses can be expensive and not easy for you to get to. And we know that they need to be adapted to suit the situations that you work in. So we want to address that by providing really relevant, current and helpful emergency care training. Next slide. So a few years ago, the World Health Organization, one of their big emergency care teams, develop the basic emergency care course. And this is a 5-day program. It's a face-to-face program where they teach and train in skills to support patients and conditions when people have an emergency. So it teaches you how to look after people who have strokes, cardiac issues, hemorrhage, trauma, all sorts of emergency situations. But it also teaches you how to establish the systems around you that will support providing really effective emergency care. So we're going to use this program and develop it to suit the context within which you work. And we're hoping to be able to provide that for a great many nurses, and particularly midwives, who have told us that they don't have access to this training in many of the places where you work now. Have the next slide. So we just want to introduce this campaign to you today. We absolutely are committed to it being led by the countries within which we will be working. So we will work with your countries to support the rollout of these programs, making sure that they really are the context and they suit the context where you're working. If you're a small island country or a bigger country, we'll make sure that we tailor make the programs to suit your needs. It's a cheap course. We're working on developing funding streams and mechanisms to work with ministries of health, government, and supporting donors to bring these courses to you. And then just to finish off quickly, next slide. You can see here, this is, I'll briefly talk about this. It's just the planning of our program. It's going over 5 phases, starting off now with just planning how we will deliver this and working its way right through to the end of December 2025, when we hope to be able to have scaled up, rolled out extensive numbers of courses for you with refresher training to make sure that if you've done the training once, it's not just a standalone program, and that it will be able to be, you can have refresher resources, sessions that you can come back to time and time again to support your training and your learning. Just finally then, the next slide. I just want to say that on our community of practice, you will find a lot more information about this campaign. You'll find all the resources, many in the different languages, for those of you that would like to see them in different languages that you speak and work in. And we really do encourage you to join the groups, to look at what's going on, to support our lifelong learning in emergency care. We know that this is much more than just a 5-day program, and it's around system change, working with partners, really trying to embed our learning into places where it can have the greatest impact. And the final slide for me is just to say, delighted that we have the full support of our wonderful new Chief Nursing Officer, Dr. Amelia. And we're really, this is a call out to you to really support our program. We need to make those gaps smaller between critical skills and to strengthen emergency care. So I hope you will hear more about this course in the near future. We're going to do a lot of work to scale it up and to bring it to countries who need it most. So that's for me. Back to you for some questions and answers now, Frida.
Yes, thank you so much, Emily, for this clarifying presentation. So now I actually want to give the word to our other colleague, Leoline Becker. So please, over to you for the questions and answer session.
Thank you so much, Frida. Hello, everyone. My name is Leontien Becker, and I'm Technical Officer Midwifery and also midwife. And I'm currently working at the WHO country office in Nepal. Please, if you have any questions about the presentations, I want to invite you to write them in the Q&A. And I already saw some questions coming in. I would like to start with a question from Dr. Saritha Donti for Professor Jane Sandel and for Justine. The question is, how can we increase better service of midwives with good pay in underdeveloped nations where post-maternity care is not available and natural birth with risk is done? Over to you.
Shall I kick off, Justine?
Sure.
I think this is a crucial issue, because not only do we want professional midwives, we want them working in a health system where they're well supported to do their work, and they're in a collaboration network, but we need them to have proper employment conditions and pay to support them to do their job. And I think this is why when Justine was talking about the 3 work packages for the toolkit, we need to focus on the wider enabling policy environment. We need to focus on how the health system can support midwives to do their job well. And also, in addition, how we educate and continue professional development support for midwives. And that's why it's focusing on 3 strands. I'm going to hand over to Justine at this point.
Thank you very much, Jane. Yeah, I have nothing else to add to this. I had exactly the same answer in mind, and this is why, you know, the group is going to look at those issues. And I just want to add that it has been highlighted, those barriers of implementation of midwifery services have been highlighted in a publication done by WHO a few years ago, and also addressed in the strategic direction for nursing and midwifery endorsed by the member states of the World Health Organization. So I strongly advise you to look at those documents for more information, or to wait for the publication of the implementation guidance when ready.
Thank you both for answering the question. Then there was another question for Dr. Emily McWhirter about the emergency care campaign. How can people get access to the trainings from specific countries? Over to you, Emily.
Thank you very much. So it depends which country you are and what exists already. So as I said, this is a program that has been going on from the WHO for the last few years. So it does exist in many countries already. The thing that we have found is that many nurses and midwives don't always get access to it or don't know that it's going on. So it's a question of looking at where you are living, where you're working, and talking to your employer and finding out whether it exists in your country now. If it doesn't exist, we will be able to promote on our community of practice countries who are going to be the early adopters of our campaign. But I think what would be great to hear from you is, if it isn't exists in your country, to engage in our community of practice and tell us why it would be important, and then we can work with you to see whether we can influence, whether we can bring it to you. But as I say, it is in many countries already, and sometimes it's just a question of activating access points for nurses to be able to join, nurses and midwives particularly, to be able to join courses that are already going on. Thanks, Lindsay.
Thank you very much for your answer, Emily. Due to the time, we have time for one more question. And there was one more question from Zanele Zombie for, again, Professor Jane Sandel and Dr. Justine Denet. How can people be involved in the midwifery-led care? Could you elaborate on that? Over to you.
I think that's one for you, Justine.
Yeah, sure. So I didn't really understand if the question was to how can this person be involved in the work that we are conducting with the stage group, or is it like how to be involved in midwifery-led care in general? I think it's maybe for the first option. Do you know if you have any precision to this, Leontine?
Unfortunately, I don't. I'm sorry.
You don't. Okay, so I will understand it like this, that way, and I'm sorry for the person if it's not the case. So the working group has been established, and the subgroups as well, with 45 plus members. So it's already settled. So for now, we are going to work with those members from all the regions. But of course, we will be looking for case studies about experiences of implementation of models of care in the country. So if you have some, you can always reach me on the community of practice, the Global and Nursing and Midwifery Community of Practice, in a private message. But unfortunately, for being involved more in the working groups, it won't be possible. Thank you.
Thank you so much, Justine. I am aware that there are more questions in the Q&A. Thank you for participating. Unfortunately, we can't answer them now due to the time. What we will do is that we will answer them in a document, and we will make sure to share the document with you. So you will get your answers. Then we will go back to Frida for the wrap up. Thank you. Over to you, Frida.
Thank you so much. So now we actually have come to the end of this presentation, and I want to give the word to Dr. Alison Moran, who is the unit lead for maternal health at the Department of Maternal, Newborn, Child, Adolescent Health and Aging. So if you thought Andrew had the longest title, I think Alison would have even longer. So over to you, Alison.
Great, thank you so much, Frida. And it's been such a pleasure to be with all of you today. Happy International Day of the Midwife to all of you who have joined today. It's really an honor and a privilege to be able to be with you this afternoon or this morning or this evening. And I just wanted to reiterate WHO's commitment to midwifery and to all of you out there who are working day in, day out to provide a better life and better quality and respectful care for women and babies around the world. So just to echo what Dr. Tedros, and I know we couldn't hear all of Dr. Banerjee's message, and Dr. Amelia saying, and just celebrate that, we let you know that WHO is with you, we support you, we value your work, and today we celebrate with you. And we understand and appreciate the incredibly critical role that you play to support women, babies, families, and communities everywhere to make a better life for women and their families. So we cannot achieve the Sustainable Development Goals without you. We cannot achieve universal health coverage without you and your incredible commitment. So thank you again for everything that you do for all of us, and know that we are standing with you, arm in arm, hand in hand, celebrating your incredible achievements. So with that, I'll turn it back over to Frida. And thank you so much for joining today and for sharing all of your stories and incredible questions. Back to you, Frida.
Thank you so much, Alison, for that warm words of your closing remark. Thank you so much. And I know that you are on the run, so good luck with your flight to Cape Town.
Thank you very
so much for
Hope to see
participating.
many of you in Cape Town.
Yes. So bye-bye. So I actually will give the word over to Emily. Over to you for your closing words.
Thank you very much, Frida. And I just want to say thank you to all our wonderful speakers today, all our panelists, for that inspiring set of really interesting talks. You've raised lots of amazing issues, really reflected the work that's going on, and the things that need to be done going forward. So I'm very, very grateful. I would also like to say thank you to our fantastic interpreters. I know sometimes we all talk too quickly. We change what we want to say halfway through, and you keep up in the most wonderful way. So really great, and thank you for that. We do recognize that making sure our webinars are accessible in different languages is a really important fact to us. So we thank you for the work that you're doing to help us with that. I just want to say to our wonderful audience, thank you again for joining us. We've had a load of you today, more than 250 at times. So very, very grateful that you gave the time to share with us today. Thank you for your chat, for your questions, and for being part of what we consider to be a very special and valuable community. Just as a notice, next Friday, for those of you that don't know, is International Nurses Day. So it's the time for the nurses to have their day in the sunshine. Please join us for that as well if you're free. There's information on our community of practice to tell you about another really exciting webinar where we're bringing some senior government chief nurses to talk with our chief nursing officer around real problems, global issues, and to say thank you to their regional nurses and midwives. So it'll be a very special session for them. We hope you'll join us. So one more thing before you go, we want to celebrate again the WHO's 75th birthday, and we're going to leave you with a beautiful film just to remind you all of the work that as a global community committed to good health that we've all worked for in the past. Your survey, if you were happy to complete that at the end, will come up on your screen after the film. And once you've completed your short feedback survey, you'll be able to receive your certificate. So I'm going to leave you with the film. Enjoy it. Thank you again for being with us today. And once again, a huge thank you to midwives everywhere in the world. Your work is outstanding and we applaud you for everything that you do. Have a wonderful celebration. And I'll leave you with the film.
This is the story of health. No, it's not just about eating your vegetables and growing taller. It's about how the world's people came together to help us all live long and healthy lives, making amazing discoveries like new medicines and vaccines, guiding us to grow up healthy, strong, and happy, keeping us safe from nasty diseases, painful ones, and deadly ones, and some horrible ones you've never heard of because they were completely wiped out.
The end of smallpox, the magnificent chapter in international collaboration.
This long-awaited malaria vaccine is a breakthrough for science.
Has finally been declared free of wild poliovirus.
It was really a story of human perseverance, innovation, commitment, bringing communities together towards one unified goal.
This is a story about all of us because we all played a role. And if we can keep working together, we'll make more discoveries, have more victories over diseases, and help even more people be healthy and happy in the future.